When assisting a resident with ambulation using a gait belt, the CNA should place the belt A. Over the resident's chest. B. Around the waist, over clothing. C. Under the arms. D. Around the neck for support. Answer, B. The gait belt must be secured around the resident's waist over clothing to provide a firm and safe grip during ambulation without restricting breathing or causing injury. A CNA finds a resident on the floor. The first action should be to A. Move the resident back to bed immediately. B. Report the fall after the shift. C. Help the resident stand up quickly. D. Call for help and check for injuries. Answer, D. Safety is the top priority. The CNA must call for assistance and assess for injuries before moving the resident to prevent further harm. Proper body mechanics help CNAs to A. Move faster while working. B. Prevent injury to themselves and residents. C. Reduce rest periods during shifts. D. Lift more weight than normal. Answer, B. Proper body mechanics, such as bending at the knees and keeping the back straight, protect the CNA and the resident from strains, falls, and other injuries. When measuring a resident's radial pulse, the CNA should count the beats for A. 10 seconds. B. 15 seconds and multiply by 4. C. 30 seconds and multiply by 2. D. A full 60 seconds if irregular. Answer, D. If the pulse rhythm is irregular, it must be counted for a full minute to obtain an accurate rate and detect possible cardiac irregularities. The CNA should wear gloves when A. Changing bed linens in an occupied bed. B. Feeding a resident. C. Taking a resident's blood pressure. D. Assisting with personal care involving body fluids. Answer, D. Gloves protect against contact with blood or body fluids, which can transmit infections, ensuring safety for both the resident and CNA. Which of the following actions helps prevent pressure ulcers? A. Repositioning residents every 2 hours. B. Keeping the sheets tightly tucked. C. Massaging red areas frequently. D. Encouraging long bed rest. Answer, A. Frequent repositioning relieves pressure on bony areas, promotes blood flow, and prevents the development of pressure ulcers. A resident with dementia begins shouting during care. The CNA should A. Yell back to get their attention. B. Stop care and speak calmly. C. Restrain the resident immediately. D. Leave the room without explanation. Answer, B. Remaining calm, stopping the task, and speaking softly helps de-escalate agitation and maintain trust with dementia residents. When providing perineal care for a female resident, the CNA should clean A. From back to front. B. Side to side. C. In a circular motion. D. From front to back. Answer, D. Cleaning from front to back prevents the spread of bacteria from the anal area to the urinary tract, reducing infection risk. What should the CNA do if a resident refuses care? A. Force the care to be completed. B. Report the refusal to the nurse and document it. C. Ignore the refusal. D. Convince the resident by arguing. Answer, B. Residents have the right to refuse care. The CNA must respect the choice, report it to the nurse, and document the incident accurately. A resident begins choking while eating. The CNA should A. Give them water immediately. B. Wait for the nurse to arrive. C. Hit their back continuously. D. Perform abdominal thrusts if the airway is blocked. Answer, D. Abdominal thrusts, Heimlich maneuver, should be performed when a resident cannot breathe or speak due to choking, to clear the obstruction. Before assisting a resident to eat, the CNA should always A. Give medications first. B. Wash their hands and the resident's hands. C. Ask the nurse to feed the resident. D. Test the resident's temperature. Answer, B. Hand hygiene prevents foodborne illness and cross-contamination, ensuring a safe and sanitary meal environment. What is the correct way to identify a resident before care? A. By room number. B. By name tag on the bed. C. By asking the resident to state their name and checking their ID band. D. By appearance. Answer, C. Verification by ID band and verbal confirmation ensures that the right care is provided to the correct resident, preventing errors. When transferring a resident from bed to wheelchair, the CNA should: A. Place the wheelchair on the resident's weaker side. B. Lock the wheelchair wheels. C. Keep the bed at its highest position. D. Pull the resident up by the arms. Answer, B. Locking the wheelchair ensures stability during the transfer, reducing the risk of falls or accidents. When should a CNA report changes in a resident's condition? A. At the end of the week. B. Only if it's an emergency. C. Immediately after noticing the change. D. During the next team meeting. Answer, C. Immediate reporting ensures timely medical assessment and intervention, which can prevent complications or serious outcomes. A CNA finds a resident smoking in their room. The best response is to: A. Take the cigarette and scold the resident. B. Report it to the nurse immediately. C. Ignore the behavior. D. Open the window for ventilation. Answer, B. Smoking in unauthorized areas violates safety policies and can cause fires. The CNA must report it immediately. Which is an example of proper infection control? A. Reusing disposable gloves. B. Washing hands before and after resident contact. C. Wearing jewelry during patient care. D. Sharing personal care items between residents. Answer, B. Handwashing is the most effective infection control measure to prevent the spread of pathogens in healthcare settings. If a resident is unconscious, oral care should be performed by: A. Using a moistened sponge-tipped swab. B. Brushing their teeth normally. C. Pouring water directly into the mouth. D. Avoiding oral care altogether. Answer, A. A moistened sponge prevents aspiration and maintains oral hygiene safely for unconscious residents. The CNA observes a small bruise on a resident's arm. What should they do? A. Ignore it if the resident says it doesn't hurt. B. Report it to the nurse immediately. C. Cover it with makeup. D. Wait until the next shift to mention it. Answer, B. Any sign of potential injury or abuse must be reported immediately to ensure the resident's safety and compliance with abuse prevention laws. What should a CNA do if a resident starts to fall? A. Try to hold them upright completely. B. Pull them back up quickly. C. Step back to avoid injury. D. Ease the resident to the floor and protect their head. Answer, D. Supporting the resident's fall minimizes injury risk. The CNA should guide them down safely, never try to stop the fall abruptly. Which of the following is a sign of dehydration? A. Moist lips and strong pulse. B. Dry mouth and decreased urine output. C. Flushed skin and high appetite. D. Normal temperature and pulse. Answer, B. Dehydration signs include dry mucous membranes, low urine volume, and increased thirst, requiring prompt reporting. The CNA should position a resident with breathing difficulty in: A. Supine position. B. Sims position. C. Prone position. D. Fowler's or semi-Fowler's position. Answer, D. Fowler's position helps expand lung capacity, easing breathing for residents with respiratory distress. When making an occupied bed, the CNA should A. Leave the side rails down for convenience. B. Keep one side rail up for safety. C. Remove all linens at once. D. Work from both sides at the same time. Answer, B. Keeping one side rail up prevents the resident from rolling out of bed while the CNA changes the linens safely. Which of the following demonstrates respect for resident privacy? A. Closing curtains and doors during care. B. Leaving doors open for air. C. Discussing care in public areas. D. Ignoring requests for modesty. Answer, A. Privacy and dignity are key resident rights. Curtains and doors should always be closed during personal care. Which type of isolation requires a mask, gown, and gloves? A. Standard precautions. B. Airborne precautions. C. Contact precautions with droplet protection. D. Reverse isolation. Answer, C. Combined precautions protect against infectious agents transmitted by contact or droplets, requiring full PPE. When collecting a urine specimen, the CNA should ensure A. The container touches the patient's skin. B. The specimen is labeled and sent promptly. C. The container remains open during collection. D. The resident drinks water during collection. Answer, B. Proper labeling and prompt delivery prevent contamination and ensure accurate test results. A CNA notices a resident's call light is out of reach. The correct action is to A. Ignore it until the nurse rounds. B. Place it within reach immediately. C. Wait until the next care routine. D. Leave it on the table. Answer, B. Residents must always have access to their call light to ensure safety and immediate help in emergencies. When feeding a resident with dysphagia, the CNA should A. Offer thin liquids. B. Feed quickly to prevent fatigue. C. Offer small bites and sit the resident upright. D. Feed the resident while lying down. Answer, C. Sitting upright and providing small bites prevent aspiration and ensure safe swallowing for dysphagia patients. The CNA's role in care planning is to A. Write medical diagnoses. B. Observe and report changes to the nurse. C. Change the treatment plan independently. D. Evaluate medications. Answer, B. CNAs observe daily changes and report them to licensed staff, supporting effective and individualized care planning. Which of the following promotes resident independence? A. Doing everything for them. B. Encouraging them to do as much as possible. C. Refusing assistance requests. D. Limiting activities. Answer, B. Encouraging residents to perform tasks within their ability preserves dignity, confidence, and physical function. When documenting care, the CNA should A. Record care before it's done. B. Use personal opinions. C. Write accurate, objective information after care. D. Skip minor details. Answer, C. Documentation must be factual, timely, and accurate to ensure legal compliance and continuity of resident care.